Welcome to the Community Health Heroes Show, where we spotlight local organizations that provide much needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Thank you for joining us. Today on Community Health Heroes, we'll talk to a physician who will discuss the importance of not over-medicating our children. In recognition of Alcohol Awareness Month, we'll meet an addiction specialist who will talk about the prevention and treatment of alcoholism. And with National Walking Day having been celebrated on April 2nd, we'll be joined by the walk director of the American Heart Association, who will talk about the city's newest walking path in Lafayette Square and the National Walking Day activities that took place. So don't go away. We'll be right back with more Community Health Heroes.
Are you getting this, honey?
Oh, prime time. We are rolling.
All right, Mama's gonna bring it home. Mama's gonna bring it home. Okay.
Come on, watch this guy.
Oh, backwards.
Oh, don't. Oh.
It went into Bob and Carol's yard. Oh, no? Okay,
Yeah.
here it comes.
Oh, Mom!
Challenge your kids to be active and eat healthy.
All right, let's see what you can do. Let's go.
They might surprise you.
Let's go.
Search We Can for more ideas on how you and your kids can get healthy together.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
Sometimes life throws you something unexpected, but the Breeze Dream Foundation and United Way are giving both individuals and businesses a chance to help folks in our region. You can be the one to help those in need, weather their personal storms, both large and small. You can be the one to help others rebuild their lives and get back in the game. Because when you give, amazing things happen. So step up and be the next one.
Find out how you can help at thenextonesela.org.
2 outs with a runner on first base. Now the big guy comes up to bat, hitting .342 with 92 RBIs and 36 homers. This first pitch is fouled to the back.
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Did you know that 2 out of 10 children in America are on some type of medication before the age of 10? Here today to talk about the importance of being aware of the types and doses of medication we should be giving our children is Dr. Andrew Williams, Director of Psychiatry, Children's Hospital. Thank you so much for joining us today, Dr. Williams.
My pleasure.
I have a few questions, and I'm sure our audience does too. So at what age should a parent feel comfortable medicating their child at home?
Well, you know, there's no specific age to start medications for children. It really depends on the disorder and what the doctor and parent feels needs treated at that time. But that's a decision you should make with the information from your pediatrician and also the specific diagnosis.
And what steps should a parent take before medicating their child for, say, a cold or hyperactivity?
Well, for any disorder or problem that a child should have, appropriate diagnosis is the most important step, and that's the biggest emphasis we make at Children's Hospital, is that you get a careful and measured diagnosis so that you really know what disorder you're treating, because treatment follows diagnosis.
And I know there's a lot of confusion in our public with what is ADHD versus ADD. Could you explain a little bit about that?
Well, really now, and we recently have the DSM-5, which is our new diagnostic and statistical manual. And really, we've replaced ADD and ADHD with ADHD, and that's really the title for both disorders.
Okay.
But there are more hyperactive, impulsive symptoms that some children have. Some children have combined inattentive, hyperactive, and impulsive symptoms, and some children have more inattentive symptoms. So there can be different categories.
There's really not ADD and ADHD. You redefined it?
It's a little bit more specific, and it can be mild, moderate, and severe depending on how the symptoms affect a child's life and environment.
Well, that's very good information.
Sure.
What can parents do if they suspect their child has this new diagnosis of ADD?
Well, if they're starting to be concerned, one of the first steps is to talk with your teacher and other individuals in the child's life in more detail. Talk about what their concerns are about how the child is functioning. And certainly a parent should be aware of their child's functioning in their home environment. Are they having significant difficulties with symptoms of paying attention or being very hyperactive and impulsive that seems to be really disabling in some way? Then I would suggest maybe talking with the child's pediatrician, since they a lot of times are one of the most available clinicians in a child's life about possible diagnosis and further recommendations.
And then there's some research that shows that diet can impact hyperactivity. What do you feel about that?
Well, I always recommend a kind of holistic approach to any sort of healthcare issue. I encourage parents to have very healthy diets, to have lots of fruits and veggies. Those are always positive things. Get lots of exercise for their children. So although there's not strong evidence that specific foods or removing specific foods necessarily will treat the core symptoms of ADHD, it's always a recommendation for any physician that a child and family have a very healthy approach to diet and exercise.
So basically a healthy diet overall would help improve
Healthy
symptoms.
diet, minimize excess sweets, minimize soft drinks, minimize exposure to caffeine.
And switching gears a little bit, if a parent accidentally gives a tablespoon of a medicine instead of a teaspoon of a medicine, what should they do?
Well, they certainly, if they have significant concerns, should always, they can always call 911 immediately and call poison control and ask for recommendations, because we always want to put the safety of a child first.
And then the last thing I wanted to ask you about is, where can a parent go if they need more information about medicating their child in general?
Well, in general, you can always go to the American Academy of Pediatrics website. You can also go, for psychiatric issues, to the American Academy of Child and Adolescent Psychiatry for children's information about medications and recommendations. There's wonderful facts for families on that website that parents can read and review about different disorders and the assessment of these.
Is there anything else you'd like to share with us today?
Just really want to emphasize that with any disorder, including ADHD, how important it is to get a careful diagnosis, because with these disorders, what's more common than the exception is a lot of other disorders. So although you may think a child has ADHD, a careful and measured assessment may uncover other problems in a child's life, like learning disorders or problems in relationships with caregivers or other issues. So we really don't want to miss the forest for the trees and be very careful and have a very longitudinal diagnosis of a disorder with all the information we need.
And I think you had mentioned something earlier when we were preparing for the show, that exercise is important in the diagnosis of ADHD.
Well, I think exercise is extremely important in the overall health and functioning of kiddos. We see in some schools now, due to exigencies and other problems, that there's not enough time to really spend outside or to spend in recreation, and that can be an important part of really helping a child pay attention and focus.
Kind of get the squiggles out.
Definitely have to keep moving. We're meant to move.
Thank you. I really appreciate the information you provided today, and thank you so much for joining us.
My pleasure.
And we'll be right back with more Community Health Heroes.
NFC, AFC, offensive linemen, defensive tackles, quarterbacks, and cornerbacks are all working with United Way for a million little reasons. The kids of our communities, to ensure their academic success all the way to graduation day. You see, it takes about 12 years to create a graduate, but it takes the same time to create a dropout. And the difference between a kid becoming one or the other could be a professional athlete, or it could be you. Studies showed the earlier we get to kids, the better their chances. So become a United Way volunteer reader, tutor, or mentor, and make a difference in the life of a child, for the life of that child.
Give.
Advocate.
Volunteer. Live united. Join your favorite NFL players. Take the pledge. Go to unitedway.org.
Here we go. We're gonna make some juice.
It's gonna be good.
She's excited. A little bit of kale.
Please don't put this on line.
I'm putting it all over the line.
It's wet. It needs something. No, it'll go.
Don't break my juicer. Looks good.
You ready to try it?
Come on, baby.
Challenge your kids to be active and eat healthy.
It's okay.
Okay, all right.
They might surprise you.
Hey, she took another sip. You saw it?
Search We Can for more ideas on how you and your kids can get healthy together.
This is my computer.
This is your computer. Let's go on the internet.
Let's go. Click it.
Yes.
Okay.
I cursor in between the R and the E. If I say dot, I want you to just push the period.
She's gonna love me all over again now.
That's it. Jamaica, here you go.
Here we go.
Good job.
Thank you. Thank you. And I did it by myself. Feel smarter.
Did you know that at least 150 minutes of moderate physical activity each week, like very brisk walking, will improve your circulation, lower your cholesterol and blood pressure levels, and promote weight loss? Join us today to talk about the importance of walking your way to better heart health and recent National Walking Day activities is Jenny Daniels, Walk Director for the American Heart Association. Thank you for joining us today, Jenny. Can you tell me how many lives are lost in Louisiana every year from heart disease and stroke?
Well, it's around 12,000 lives, so it's a lot of people here in Louisiana, and in the United States as a whole, 1 in every 3 deaths is caused by heart disease and stroke. So it's really a large number.
That is a large number. And what can you tell our audience about what steps can somebody do to help prevent heart disease?
Well, there are some non-modifiable risk factors for heart disease: your age, your gender, your family history, but there are quite a few modifiable things that they can do on a daily basis. You can manage your cholesterol and blood pressure, you can manage your diabetes, you can stop smoking, you can eat better, you can lose weight, but I think the easiest one is getting more physical activity. And so the AHA encourages everyone to get at least 30 minutes of physical activity each day of the week. And the easiest thing to do is go out and go walking. And so it's something that's something that you can fit into your daily life at any point, and you can do it for however long that you want and have the intensity that you want for your walk. So the walking is really what we encourage everyone to start doing if they need to have a physical activity plan.
And you can break it down. Say you can't do the whole 30 minutes all at one time. There's studies that show you can break it down.
Yes, you can break it down into any, increment and do that throughout your day so that you have at least 30 minutes for 5 days. So that's a total of 150 minutes.
And what can companies do to encourage folks to walk or get exercise?
There's a variety of things that you can promote in your company. You can do wellness pamphlets, flyers, online newsletters. You can encourage people to do a walking plan that tracks their steps. You can encourage people to take the stairs if you have a multi-level office. You can give out pedometers to everyone. Encourage a handful of sneaker or workout attire days throughout the year. You can also do a walking path in your office, so you can designate a specific distance, maybe 4 laps around equals a mile. And you can also work out a discounted membership with local fitness facilities. So there's a lot of different things that companies can do to be creative to get their employees active.
Absolutely, those are great ideas, Jenny. And can you tell me about a recent event between American Heart Association and United Healthcare?
Yes, United Healthcare is joining us for our National Walking Day. We do National Walking Day every year, the first Wednesday in April, and we'll be celebrating, or we are celebrating, we've celebrated very uniquely this year by inviting local leaders to join us on a treadmill in front of Whole Foods on Magazine Street. So it's going to be a little bit different this year. Usually we have a big walking event, but this year we really want to try to raise awareness with our leaders and get everybody out walking and doing at least 30 minutes of activity.
And that was already on April?
April 2nd.
Okay, that's awesome. And then also, can you tell me about the new walking path?
Yes, we're really excited. We've already established 2 different walking paths. This will be our 3rd. It's at Lafayette Square, and it's a great location because it's really close to Poydras and the courthouse, so a lot of people will be able to come out and walk that path. It's on St. Charles, Camp Street, North Main Street, and South Main Street. So it's at Lafayette Square. And it's also where they hold all the concerts on the square and Harvest the Music. So it's something that will be accessible to a lot of different people. And it's 4.5 laps equals a mile. So
wow. So there's signs that mark
There's
out.
signs that will mark it. And we find that if you designate an actual distance, more people will be motivated to actually walk the full mile.
Right, rather than just go around once or twice. If they know they have to go 4.5 times.
They'll do the 4.5 times and get in a longer period of physical activity. So that's always good.
And where are the 2 other parks that are sponsored by American Heart Association and United Healthcare?
The other 2, the first was at Duncan Plaza, which is kind of right down the street, right in front of City Hall, and then Palmer Park, which is uptown off of Carrollton and Claiborne.
Now, you see a lot of activity at the first 2 parks?
Yeah, it's very successful, and a lot of people are getting out there walking, so it's really good.
And where can somebody go if they want more information about their heart health or walking?
The best place to go for local and the most up-to-date information is our Facebook page, so facebook.com/AHA New Orleans.
So AHA New Orleans?
Mm-hmm. And then also, we do offer a variety of tools for tracking walking programs, recipes, health information at startwalkingnow.org. And so that's all free and available to the public.
Great. Is there anything else you'd like to share with us today?
We're just excited about National Walking Day and getting the awareness out for more physical activity and really encouraging everybody to make healthy choices in their lives.
Well, this is just great information, Jenny. Thank you for joining us.
Thank you.
And we'll be right back with more Community Health Heroes.
Packers, Vikings,
Red State, Blue State.
We come from different places.
Uptown.
But when we live united, we create real lasting change in the education, income, and health of our country. Real change won't happen without you. So give, advocate, volunteer, Live United. Sign up at liveunited.org.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
When you have a hole in your neck, don't face the shower head.
Suction out your dough before you eat. Crouch. Don't bend over. You don't want to lose the food in your stomach. Don't use spray paint.
Be very careful shaving.
Welcome back. In a city with seemingly unending celebrations, many fueled by alcoholic beverages of all kinds, it is important for people in our community to understand the importance of drinking responsibly. Joining us to talk about alcohol prevention and treatment is Chief Medical Officer Dr. Howard Wetzman of Townsend Treatment Centers. Thank you for joining us today, Dr. Wetzman.
Thank you.
How can an individual or family member determine when somebody's crossing from a social drinker and possibly leading down that path to alcoholism?
Well, one thing, that presupposes that actually that's how it works, and it turns out that's not. But for decades, we've thought in our society that people have to start drinking, then they have to abuse the alcohol, then the alcohol changes something in their brain, they become alcoholic. Actually, since the decade of the brain, which was 1990 to 2000, the neurobiology we understand now becomes clear that addiction's largely genetic, and that the signs that someone can't safely drink are not about the amount the person drinks, but what the drink does to the person.
And can you give me some examples of warning signs that a person could look for?
Sure. So a normal person's response to alcohol is after a few drinks, they're getting a kind of a relaxed, slowing, mildly mellow feeling. A person who's having a drug response to alcohol as opposed to, well, I really should turn that around, who's having a medical response to alcohol because the alcohol is actually fixing something that's wrong, that person is going to have an energized feeling. So just the opposite. Much like with opiates, you know, we call opiates narcotics. Narco is Greek for sleep because 90% of the population goes to sleep when they take an opiate. 10% of the population gets up and does their shopping and does the laundry and paints the fence.
And then you brought up an interesting point. So really, what's the difference between addiction and substance abuse then?
Right, so substance abuse is a normal brain doing something stupid with drugs or alcohol, as opposed to alcohol use, which a lot of normal people do and don't abuse it. Addiction is an ill brain trying to feel normal.
And so can you expound on that? Give us some examples of an ill brain. I mean, how would you recognize an ill brain? And would you be leading back to the example that, you know, they're medicating themselves with alcohol? Right.
So for a long time, because we thought that the only thing that could be wrong with someone with addiction was the drug, that led to two ideas. One, you couldn't have addiction unless you were using drugs or alcohol. And two, all you had to do is stop using drugs or alcohol and you'd be normal, go back to being fine, except for whatever damage was done. But it turns out that neither of those is true. Addiction is a disease that exists outside of the spectrum of what you're using to feel better when you have it. And it has a set of primary symptoms that go along with not having enough dopamine in the brain's reward system. These are things such as, I can't pay attention, I can't remember things well, I don't enjoy things the way other people around me enjoy them, I don't make connections to the people around me. So these and some others are the primary symptoms of the illness. And when those things are made better by a chemical, you're getting a big dopamine spike, a big reward spike. And like any rewarding event, your brain remembers that thing is really good.
Right.
Go get more of it.
And talking, kind of switching gears and talking about what treatment protocols have shown more success if somebody goes and gets assistance for their substance abuse or addiction.
Well, again, when we used to think of this as substance abuse treatment, it was pretty much we tell people what they were doing was a bad idea, stop doing it, you'll feel better. And they kind of looked at us and said, well, you're nuts because I know that I feel terrible when I stop drinking. And so at our treatment center, we've turned that around and we've said, let's fix what was wrong with you to begin with. And we understand that this is largely genetic. So we use genetic testing. And we, not as a diagnosis, we can't do, you know, you have addiction with a genetic test, but for the doctors to use to tailor their medical treatment. And we use computerized neurocognitive tests to actually measure a proxy for dopamine tone at the midbrain to see if the medicine's having the desired effect. And then we find that when we do that, we actually can make the psychosocial change with the patient much easier than in the old days when it was just stop using and gut through it and listen to me, and if you don't listen to me, you're bad and stupid and wrong.
So you're using more testing and more medications to help replace the dopamine that's missing.
Right, because it's an actual disease. And the truth is, throughout medicine, the treatment works for disease. And like in the old days, they used to say, well, you have to want treatment to work, to have it work. Well, no one ever said that about tuberculosis. And any medical illness, treatment works.
And you had mentioned psychosocial, and that kind of brings up the idea of how important is it to have a supportive family or a support structure behind you?
It's pretty critical. Nobody recovers alone. Not everybody's family is conducive to recovery. Because the disease is largely genetic, a lot of times the family is also, at least in part, affected by the genetics of the illness. And so we've seen situations where Mom and Dad will bring Junior in because of some drug. And they really don't want to hear about Dad's drinking. And so it becomes, at that point, it becomes important for us to help the adult Junior figure out where he's going to go and who he's going to hang with to find the right social support.
Absolutely. And how can our audience find out more information, say themselves or a loved one has some problems like we've discussed? Where can they go for information?
Well, the most important thing to know is that there is help. There's lots of help, everything from the phone book to the internet. And there are lots of treatment centers out there. We're not the only one. The government also has a lot of good resources. National Institutes of Drug Abuse, which is NIDA.gov. National Institutes of Alcohol Abuse and Alcoholism, which is NIAAA.gov. A lot of good technical information there. And if anybody just Googles addiction treatment and their name of their town, they'll get lots of resources.
So addiction treatment and the name of the town?
Yes,
okay.
Or just Google Townsend. We'll be there too.
Is there anything else you'd like to share with us?
No, I'm so happy you asked me to be here. I very enjoyed it a great deal.
Well, I'm so happy you joined us because this is valuable information. So thank you so much, Dr. Wetzman.
Thank you.
And we'll be right back with more Community Health Heroes.
Each year, loving parents and caregivers cause serious injury and even death to infants by allowing unsafe sleeping conditions. Never sleep with your baby on a sofa, in a chair, or in an adult bed. Don't allow the baby you love to be the next tragic statistic. The only safe place for your baby to sleep is on its back in a crib. For more information, visit cribsforkids.org.
Quiet, please. Wait a sec. I'll take one. Oh yeah. All right. All good. Take care. Way to go. Nice. Bring it on. Gotcha. I'm here for you. Oh no. Please, please, please. I'm waiting. Interesting. Not buying it. Not fair. That's it. This conversation is over. Oh, brother.
Body language can tell you all sorts of things.
I'm having a stroke. I'm having a stroke.
Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time. Time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
For those dealing with the daily struggles of caring for a loved one, we hear you. That's why AARP created a community with experts and other caregivers to help us better care for ourselves and the ones we love.
Separate raw meats from other foods by using different cutting boards. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Thank you so much for joining us. If you would like to suggest a health topic or send us information on your health organization's events, please visit our Facebook page or email us at communityhealthheroes@gmail.com. We hope that the information we provided today will help you and your family live healthier and happier lives. I'm Dr. Penny Walker, and I'll see you next time on Community Health Heroes.